Welcome everyone to the IGWG June Gender Knowledge Exchange event, examining intersectional approaches in gender transformative programming. Again, as colleagues continue to join, we encourage you to introduce yourself in the chat, sharing your name, your role, and where you're joining us from. Next slide, please. My name is Francesca Alvarez, and I'm a policy analyst with the Population Reference Bureau, or PRB, where I lead our support to the Interagency Gender Working Group, or IGWG, which is supported by the USAID-funded Propel Health Project. We're excited that you could join us for this important event today, focused on examining intersectional approaches and gender transformative programming, as well as documenting and capturing intersectionality and gender transformative programming. There are increasing calls from programmers, researchers, and community advocates for gender transformative programs to systematically incorporate intersectionality as a core principle and into more holistic operational frames. Originally coined by Kimberly Crenshaw in 1989, the term intersectionality illustrates the effects of overlapping systems of discrimination, such as those based on gender, race, class, sexuality, and other identities. Intersectionality recognizes that people's lives are shaped by their identities, relationships, and social factors, which combine to create intersecting forms of privilege and oppression. Although gender is widely understood in public health settings as a concept that incorporates behaviors, expressions, identities, norms, and institutional practices, many interventions still rely on reductive conceptions of gender and family relationships that can miss the mark in addressing the wide array of lived experiences across the diversity of people affected by gender bias, discrimination, and violence. Additionally, program implementers and gender practitioners are grappling with how best to integrate intersectional considerations in their efforts to advance gender equality for all individuals. An intersectional lens in gender transformative programming encourages us to move beyond single identities or group-specific concerns and offer greater insights into human lived experiences. It also encourages us to better understand the connections between structures that shape diverse populations and to design and implement more effective and efficient responses for solving persistent and growing gender inequities. By applying an intersectional approach in programming research and policy, advocates can improve their understanding and application of the dimensions of power, historical structural inequalities, and the role of social determinants of health across a diversity of issues that intersect with gender. As a result, programs will be better prepared to address the context-specific root causes of such inequalities and can reduce structural barriers that limit certain people's access to, participation in, and benefit from health and development interventions. Today's IGWG Gender Knowledge Exchange event aims to first explore insights into the what, why, and how of applying an intersectional lens in gender transformative health programming and how these intersectional approaches can influence gender and health outcomes. Second, we aim to explore strategies and approaches to applying an intersectional lens to gender transformative health programming, research, and advocacy efforts. And third, we'll hear directly from advocates from diverse backgrounds and settings on their experiences applying intersectional approaches in their work to advance gender equality. We'll hear lessons learned from our fantastic group of panelists made up of experts and program implementers who will share strategies for and approaches to intersectionality and gender transformative health programs aiming to advance gender equality outcomes. We do have one important update on the speaker lineup. Dr. Olena Hankivsky, one of the previously announced speakers for this event, is no longer able to participate due to an unexpected emergency. We appreciate your understanding as we make adjustments to the panel discussion to accommodate this change. We hope that this event will allow for ample knowledge exchange and discussion, and we strongly encourage your active participation in the Zoom chat during the panel discussion and following Q&A session. You'll also have the opportunity to participate more actively in the discussion in breakout rooms. Today, we really want to hear from you. Next slide, please. We have a packed agenda for today's event, and I'll also note that the key takeaways and recommendations emerging from our event will be shared with IGWG members afterwards. First, my colleague Jade Lay will lead us through a short interactive activity, and then we'll turn to a panel discussion. Afterwards, you'll all have the opportunity to pose questions to panelists during a Q&A session. We'll then transition into breakout rooms for small group discussions designed to capture learnings from your own experiences with applying intersectional approaches in your work, as well as reflections from today's event and discussion. Following breakout rooms, we will reconvene as one group for report back, where we'll ask a representative from each group to share key takeaways from your discussion. Finally, we will end the event with brief closing remarks and share a link to a post-event evaluation survey. I'll now share a few brief housekeeping reminders, though I'm sure we're all Zoom experts by now. Throughout today's event, with the exception of the Q&A discussion and breakout room discussions, we're going to request that you please keep yourself on mute and turn off your video to minimize background noise and competing screens. We invite you to use the Zoom chat to ask questions and share comments on the discussion. And during the Q&A portion, if you're joining us by phone, please do introduce yourself before asking questions so we know who you are. And if you're having any connectivity issues during this event, please do send us a message in the chat. You can also privately message me and we'll work to address any technical issues. Next slide, please. I'll now turn it over to my colleague, Jade Lang, who will start us off with an interactive activity.
Sorry, I was muted there. Hi, everyone. Welcome. So we are going to start today with a brief interactive activity to get us all started thinking about intersectionality and what it means to us. So my colleague, Dev Degnan, is going to just posted a Mentimeter link. So if everyone could click on that, that would be great. And it's just a word cloud that's just going to ask you to name the first word that comes to your mind when you think of intersectionality. And we'll just give everyone about 2 minutes to kind of put a couple of their thoughts in, and then we are going to take a look at the responses. You can put up to 3 words. One at a time, though. Oh, Lavana said connectedness. That's great. Do you mind popping that in the link that my colleague Devin shared, Lavana? Perfect. Thank you so much. Okay, we'll just give everyone another 30 seconds or so, and then my colleague Devin is going to share her screen and show us the results of this activity. Oh, great. Okay, so some of the larger responses, which indicate that they were submitted multiple times, are things like identities, gender, disability, vulnerabilities. So these are kind of different aspects to be considered when talking about intersectionality. And some other things like power, justice, interdependent, interconnected, exclusion, kind of an antonym there, but I totally get it. Marginalization, marginalized, representation, poverty level, sections, analytical framework, interwoven, complexity, double bind, equity, systems of oppression, all really, really great answers. Connected social issues, evidence-based. Yeah, a lot of really, really great responses that I think we're going to delve into today in different aspects. So that's great. Thank you everyone for being so willing to give some insights into your views of intersectionality. And I think we are going to bring it back over to our presentation. So thank you everyone so much for taking the time to do that.
Great, thank you for leading us through that activity, Jade. I'm now excited to introduce our panel moderator, Dr. Lata Narayan Swami. Dr. Lata Narayan Swami, Jade, if you can go to the next slide, is an associate professor in the politics of global development, School of Politics and International Studies at the University of Leeds in the UK. She has a PhD in geography and anthropology, and her research critically reflects on gendered and intersectional and post and decolonial dynamics of development knowledge and its perceived contribution to addressing global development challenges. She is currently involved in applied interdisciplinary research related to gender, feminism, and intersectionality as these relate to climate change, water security, and decolonizing development. She is also a member of the editorial advisory board of Gender and Development and a trustee of the Gender and Development Network in the UK. I'll now turn it over to Lata to introduce our panelists.
Thank you so much, Francesca, Jade, Devin. Thank you for having me here. Thank you for inviting me to moderate. It's an absolute thrill to be here with you today. I'm very appreciative of the work to bring us all together to talk about intersectionality. It's super important. And what a privilege to be a moderator for our fantastic speakers. It's a shame Alana couldn't be with us, but we are absolutely blessed to be with our two speakers who are going to share with us their thoughts about intersectionality and hopefully to address the many questions that all of you took the time to respond to in the form that's created your responses, so we have a sense of what brings you into the space today. Lots of great questions. You're all doing some really interesting work. We're really looking forward to getting stuck in and learning from all of you about your experiences, and hopefully in that interaction, we'll try our best to answer as many of the questions that you have raised in that sort of initial kind of engagement as possible. So with us today, first we have Injeri Kimoto. So Injeri Kimoto is an international policy advisor, gender equality and social inclusion expert, capacity builder, coach, and mentor working in inclusive sector transformation with more than 14 years of experience. She is an expert and consultant with field experience in Africa, Latin America, and Asia. Her experience in international development intersects with feminism, intersectionality, and GESI, so gender equality and social inclusion, knowledge and practices. And Jerry has led regional and global teams in institutional gender transformation, lobby and advocacy and awareness raising, developing and implementing intersectional gender analysis tools for macro, meso, and micro level, and conducting intersectional feminist research, curating e-learning courses on virtual platforms, and creating and maintaining coalitions and partnerships with CSOs, INGOs, donors, CBOs, private sector players, women's rights organizations and networks, feminist movements, and governments. Her expertise and knowledge are extended to the Senara Gender Trainers Platform and African Platform Leadership for the Diversity Advancement Network in Toronto, Canada. Whew. We are literally cannot be in better company to get stuck into this topic. So woohoo, that's great. And then along with Injeri, super pleased as well that we can be joined by Duse Didi Mchihi. So Dude Didi Mchihi is a psychotherapist, intersectional feminist, and LGBTQIA+ advocate based in Nigeria. She dedicates her life to fighting for the rights of marginalized populations, and her work as an activist is deeply rooted in her commitment to social justice, equality, and equity, demonstrated by her work as a psychotherapist, grant-making panelist, and podcaster, as well as work in human rights programming. She understands that mental health is a critical component of overall well-being, and she works to provide well-being support to marginalized populations. Duse takes a holistic approach to activism, here, considering the various overlapping circumstances that might affect a person's life. So this is absolutely spectacular company. from whom we can learn. And what would be great then is for us to kick off, and I'd like to ask some questions, and then I'm going to turn over to both of you to talk us through how you might start responding to them. And we understand that this is a little bit of a whistle stop, right? We're not going to get to everything, but we'd like to start the discussion by turning over to our fantastic speakers, and then we will continue to pick up those the discussions around those questions in the breakout rooms. So to begin with, and Jerry and Duce, and Jerry, we'll start with you. What would be great would be to get you to reflect for us, what is intersectionality and what is it not? One of the things that's coming out in the form that everybody filled in is wanting to know what the opportunities are for intersectionality, particularly in gender transformative programming, but also why is intersectionality important? Lots of people talking about how they want to do this work, but either they're not sure, but also very, very difficult to, sell it to senior managers, maybe get it funded. So that kind of advice is really useful. And finally, within the question of what is intersectionality, what is it not? Maybe you can talk us through that. But also related to that, what are the myths or misconceptions around intersectionality in gender transformative health programming research and data? And what have you found challenging for programmers and researchers? So if you can maybe sort of talk through some of those, the answers that you would have to some of those questions, and then we can invite Duce to come in and also respond to some parts of that as well. So, and Jerry, please, over to you.
Thank you so much, Lata. Thank you for that fantastic introduction. I think I'll just dive right in. Intersectionality is just what is in front of our screen. It is us, me, Jerry, you, the other person behind the screen, identifying yourself in various categories when you step in the space. So when you step in a space, so long as you are interacting with the environment, you may introduce yourself as Mrs. Jerry or other identities. But in a nutshell, intersectionality is our own identity, but divided in so many ways of trying to kind of bring to the forefront who we are from the inside. So this kind of depicts what intersectionality is in summary. I think when it comes to why intersectionality, I could explain it with the next slide. On the basis that we are all human beings who identify ourselves in various ways, depending on the platform where we are or the ecosystem or the environment, the intersectionality aspect is there because we don't have a single issue struggle, as can be seen from the body passport. I like to call it the nationality passport, which kind of dissect one into so many identities. Dependingly on your identity and where you were at that time and space, you will get to experience different challenges. You'll get to experience different privileges. You'll get to experience exclusion or discrimination. So, and that's why intersectionality is very key in terms of us getting to a space where we are appreciating that there is no one single struggle for all of us, those in global south and those in global north. And that's why intersectionality is becoming central in both development and humanitarian aid. Now, I like what you asked, Lata, about what is it not? And I think the next slide helps us to kind of demystify a little bit what intersectionality is not. Intersectionality is not just an identity, like it's not just a Mrs., her, he, she. It's more than that because it encompasses the human being, and it's a way to kind of bring yourself to the forefront of the inside. And then it's not also synonymous to race. A lot of I think we have to appreciate in terms of the writings, the research, the work that has gone into intersectionality. Of course, it started with Kimberly trying to help us understand the dimensions at which African American women are confronted with different systemic issues and therefore experience them differently, but it's not as equals to race. It is more than race. And it's not also diversity. It's not about so many diversity, but it's actually trying to allow ourselves to understand, I as a person, when I engage with the system, when I engage with the society, when I engage with policies, how is my engagement, what is my engagement producing for me? Is it producing marginalization? Is it producing exclusion? Is it producing privileges? It's not also a checklist for identities. And I like this one because this is one can be, it forms a good interlinkage bridgeway as to why we are struggling with intersectionality. Because when we started off with the whole agenda of intersectionality and grappling with it, most of the time it's always relegated to you do the checklist for race, location, age, social status, but it's not a checklist as such, but it's a lens and approach to us understanding how a human being experiences the world and how they experience the world differently in the sense of the systems, the environment that's around them. It's not also an adjective, it's just a noun, and it's not because of the centrality of power when you're trying to discuss intersectionality as an application to understanding the world, the whole agenda of power comes in. It's kind of put at the locus point. So therefore, and the same thing with feminism. Feminism is also trying to interpret so many things in which we see a rotational aspect of power. But that being said, those two are different things, and therefore we try to disentangle them. I know it's not easy, and that's why I think the discussion around the challenge of how intersectionality has posed in our development programming comes in. On one hand, we know that for a very long time, as gender practitioner like me, who has been in the space for more than 14 years, I'm so used to doing gender analysis and therefore analyzing or assessing gender relations. So it's not an easy automatic press button that you'll also do understanding social relations. And that's where intersectionality forms a key powerful tool, because now with social relations, you understand that the person and how they experience the world and how they are confronted with different things from a systemic point of view when they interact with systems of power, when they interact with departments, or when they interact with policies. And therefore, we see a challenge also in us as gender practitioners trying, because then the burden of responsibility is no longer outside in, it's actually inside out, where we have to change how we've been doing analysis. And therefore that forms kind of an intrinsic struggle, in which case that we see that it's continuously calls for us to develop and add lenses, not add identities, add lenses. We've been having a gender lens for a very long time, and therefore adding another lens, which is what intersectionality allows us to do, becomes a challenge. But over time, as we continue practicing, because practice makes perfect, as we continue practicing, we now, when you look at, when you just walk into, like, let's say an airport, for example, you just automatically notice there are no ramps, because your eyes are now adding another lens of accessibility. How is someone else able to access the facility that are being provided? One of the things I have to say has also been a challenge to me is trying to also remove my personal implicit biases, where because I'm from a certain location, therefore I tend to view things differently, and therefore not allowing myself to view the world holistically, or else as another person who has not had the same lived experience. And therefore that makes intersectionality in its application quite a challenge, because, as I said, it's inside out. It's us trying to unlearn, relearn, and learn new methodologies of assessment. The other thing is that for me, the challenge has been for a very long time as a gender practitioner, it has always been a gender analysis. It's an assessment. It's just an assessment where you kind of understand gender relations in the 4 to 5 domains that are provided for by the Good Harvard framework or the MOSA framework. So it allows you to understand the gender relations in terms of division of labor, access and control, participation, decision making. So, and therefore we've been confining to this oh Lord Jesus, the English has flown, but what I mean is to just have these small boxes of matrix where we assess. But then when it comes to intersectionality, it's such a broad array of assessment, and therefore it kind of forces or challenges one to have various, more than just the 4 or 5 domains. And therefore that is what I've seen as a challenge. Now, I might talk as an abstract challenge, but I want to give my own worked out challenge. So I had a youth program where I was in charge of implementing. It was a supply chain development program where we were supposed to integrate or bring on board youth to in the coffee value chain. And therefore, for me, I thought, well, why not? It's a good initiative because it allows for youth to become more entrepreneurial, and it's actually a youth empowerment program where even young girls are going to be part of the program, therefore trying to also handle the gender equity gaps in the coffee value chain. But I can tell you for a fact, I struggled with that program. I really struggled because at the entrance point of view, when these youth were registered and contracted to be part of the program, they were 18, 19, 20, and the program was supposed to last for 3 years. And this is where now intersectionality becomes interesting, because the youth are not static. We are not static as human beings. We engage, we grow, we change. So by the time it was end of year 1, the 18 had become 19, the 19 had become 20, the 25 had moved to another age bracket. The ones that were 30 had gone to another age bracket, and the social marital status had changed. So therefore, for some, it was no longer them who are making decisions. So therefore, all these dynamics due to the changes in socioeconomic status made the whole program come to a standstill, because my way of designing the program was that we need to increase the yield, we need to have a better quality of coffee, we need to have sales volume. So it was more technical than social. And therefore, by the time we were in year 1, I had to close the program because people had moved on. And it was quite a fail. It was quite a fantastic fail. But in the fantastic of that failness, I learned a lot in the sense that we are not static human beings, and therefore an intersectional lens allows me to have better programming that kind of opens door for inclusion, and therefore social inclusion becomes a very key component beyond gender equality. I'll stop there and hand over back the mic to you later.
Thank you, and Jerry. Honestly, it's been lovely that we have 2 hours to dive into this, but you've just raised so many things. My mind is, I can't quite process it all, but I would just like to draw attention. First, thank you for your vulnerability. I think we really struggle in this sector to talk about what you described in your own words as a failure, and talking through why that was a challenge. I think we don't do that enough. So thank you so much for doing that. And I think the question of us not being, or people not being indivisible in terms of their identities is super important. But also what I found really helpful in what you just said is that you also centered us, right? We tend to think of ourselves as practitioners removed from these situations. We're not. We are in these situations too. We have our own intersectional identities, and how that interacts with the work that we do is no less important for us to engage with and understand. So lots and lots of things to get stuck into. You also talked about time, right? I might plan something now, but it doesn't make sense in a year. So yeah, my mind is exploding. Thank you so much, Jerry. That's amazing. Do say, if I could bring you in now, if you have any reflections on those questions about, what is and isn't intersectionality, but if you could also then draw in your professional, personal experiences about applying an intersectionality lens in the health programs and advocacy efforts that you have undertaken. So I'd like to turn the floor over to you, say thank you.
Thank you so much, Lata. Njeri had explained intersectionality beautifully, and it just, took my mind to several points where I had to design programs and advocacy interventions that we had the opportunity to consider the multiple identities of the groups that we were planning these programs for. So in applying an intersectional lens in program designing, first, you would have to recognize the unique experiences and challenges faced by the individuals who belong to marginalized groups that you're trying to, address, right? So for example, if you are trying to design a program for intersex women, you would have to recognize that intersex women face a lot of discrimination. They face a lot of violence because of their gender identity, their variations in sex characteristics, and also their sexuality, because your identity as an intersex person has already placed you in a place of marginalization. So if I am trying to make programs I'm trying to design a program or implement a project for an intersex person, an intersex woman, for example, it is very important that intersectional approaches are put in place. And that means that I'm trying to recognize the other levels of oppression that they are exposed to, identifying how all of this can face or construct a barrier in them achieving, health outcomes. And also, when you're applying an intersectionality in programming, you would recognize and address structural systems and barriers that, restrict health, that perpetuate or influence health inequities, such as the LGBTIQ plus community. I always try to speak more on the LGBTI community because that is the sector where my expertise lies primarily on. LGBTIQ plus individuals experience structural biases that are influenced because of their sexual orientation, So if you're trying to apply intersectionality, we should be able to break down these structural biases that hold or limits our access to applying or having comprehensive outcomes in our program designs. And also centering the voices of those that are marginalized. If you're trying to do a program or design a project, it should be targeted to the voices that are often not heard. That is what intersectionality means. It simply means that you're trying to reach those groups that ordinarily wouldn't be targeted. For example, we did a project on access to comprehensive healthcare services for women some time ago. And in that program, we realized that, we have women who have multiple identities. Now, how are we able to ensure that these women are given the opportunity to be met at their point of needs? So intersectionality for us is meeting every individual at their own point of needs. We recognize that there were women with disabilities. How are we going to make sure that we empower them enough to be able to have access to comprehensive healthcare services? Now, we also recognize that with disabilities, there might be other forms of identities that might be restricting them from, getting these comprehensive services. And in Nigeria, let me try to be very context specific. You would find different categories of women. Now, those with disabilities most times have families And sometimes they are made to have children without a partner figure. So there might be no husbands, there might be no families, and they might just be left with the responsibility of bearing and catering for children. So how are we able to bring them to the level where they are able to have access to comprehensive healthcare services, recognizing that their economic status, recognizing accessibility, and also recognizing other forms of discrimination that they may be, exposed to. So these are just very few points I would like to touch on for us to ensure when we're trying to apply intersectionality later.
Thank you so much, Dulce. That's actually been really helpful. And actually, what was really good to hear you talk about there was this question of disability. It's come up in a lot of the responses that colleagues in the room today have raised as that being an issue where it is quite difficult to know how to strike a balance between the question of, say, intersectionality and disability being one of the issues that they might be trying to support people with. What would be really helpful, I think, and one of the things that's coming through in the sorts of responses that people in the room have shared is thinking through the challenges. So what sorts of consideration should program implementers and designers and advocates keep in mind when applying intersectional approaches? So here again, Dulce, you started kind of doing this, but if you can maybe perhaps tell us concretely about the sorts of things that you've had to think about, maybe some of the barriers, like you've tried something, but actually, I don't know, a funder or a donor pushed back, maybe how you overcame that. Did you have to convince somebody of the value of what you were saying? That seems to be the kind of thing. I think everybody in the room does see in theory the value of thinking with an intersectional lens, but I think everybody and Jerry, you've already done that, which I appreciate, and also where it didn't work. But I think everybody would be keen to hear, did you overcome that? Who did you have to convince? How did you convince them? I think that kind of thing, maybe if you build more on the example you've shared already, Dulce, please, over to you. Thank you.
Okay, so one of the challenges that we have been exposed to in terms of applying intersectionality is resistance from policymakers and stakeholders. So I remember a time when we were doing a project on life planning for adolescents and youths that had to do with adolescents and youth sexual reproductive health and trying to scale up the intake of contraceptives. And we realized that this program happened in northern Nigeria, where Islam is highly practiced. And in implementing programs that have to do with contraceptives intake is quite challenging due to the religious constraints and barriers that are faced in northern Nigeria. So what we did, or what happened, was that the program was specifically for adolescents and youths, like I mentioned, of which in northern Nigeria, you would see adolescent girls from ages of 12 to 15, between the ages of 12 to 15, who are married because of the high rates of child early and forced marriage in northern Nigeria. So these programs were targeting them, but there were huge challenges getting these targeted groups to be a part of our programs because of the power dynamics that play within this context. So what we were able to do was the specific locations, which was the remote areas where we were supposed to implement, we leveraged on other CSOs or CBOs that already existed in this context. Now, we leveraged on the relationship that they had already established with people within these communities, and we were able to have a program, but there were challenges because most of the husbands, the fathers, would not let their children or their adolescent girls come to these programs without them being there. And we realized that, for us to be able to have this program effectively, then we have to involve men, we have to involve boys, we have to involve the traditional leaders, we have to involve the community leaders so that they can be drivers of this agenda that we're trying to push through. This way, there is a sense of responsibility on them to push our agenda forward. So the project had, it had to halt, because I mean, we were getting these people to participate in our program, but it wasn't effective because they wouldn't come on time, they wouldn't even take up the services that we were proposing. And then we had to stop and re-strategize. And this was also an opportunity for us to evaluate what has been done, what was going on well and what wasn't going on well for us. And by the time we were able to pay visits to these relevant stakeholders that I mentioned within these communities, there was a scale up. And at this point, they told us, they were able to give us information on what not to do, what was culturally not accepted within the community that we had earlier ignored. So by the time we were able to design projects or programs that were culturally responsive, we were able to get to the desired outcome that we had intended to earlier on. And also one challenge that we face sometimes is tokenism, right? People, program advocates are, advocating for intersectionality. Oh, we want this program to be very intersectional. We're recognizing that these groups of people might not have their voices heard. We want to bring them to the table, but most times it ends at just lip service. These programs are not really intersectional. It is just left on paper and they're just saying, so these are the challenges, right, that I have been exposed to in applying intersectionality in my programs.
Thank you so much, Dulce. Again, there's so much to sort of get stuck into. I would encourage all of you who are listening to keep track of the questions that both our speakers have raised. Please write them down. Please bring them into the breakout groups. Please reflect on whether their experiences resonate with your own. Let's talk about that. Part of the motivation for this event today has been to create a listening sort of space for you to feel comfortable to share those things that maybe you're keen to do, but you're not quite sure where to go. I think our speakers today are really offering so many fantastic insights that we can dig into and reflect on together. So Dulce, thank you so much. Given the time, because we were quite keen to make sure that there was an interactive element, and especially for colleagues in the space to be able to interact with both of you and with other colleagues at PRB. And Jerry, if I could turn back to you for just to reflect maybe, because Dulce, I think you raised something really interesting about having to sort of convince sort of the powers that be and the policymakers that that's a real challenge. And then actually this can feel incomplete, right? And I suppose I feel like in a way, what we'd want people to take away from today is, yes, it's hard, but that doesn't mean that we shouldn't try. And really what we need to do is to keep trying, however imperfectly. But and Jerry, if I can turn back to you, maybe you also, again, I appreciate your vulnerability in sharing something that you say didn't go well. But you must have had experience of talking to, say, donors and funders and the policy. How do we convince people that this is an important lens to use? What are the sorts of arguments that you've marshaled in favor of the work that you do? And Dulce, I found that really helpful. And Jerry, it'd be great to hear from you on that as well. So, and Jerry, over to you, please.
Thank you, Lata. I think for a very long time, when you look at how designing, implementation, and execution of development programs, we've always taken monitoring and evaluation and left it at that. And I think how it has worked for me is giving a complementary approach to M&E, where you introduce the aspect of learning. And learning in this case, I have had to redefine it for the program I am in. So learning does not necessarily mean collection of data, tick box indicators. No, it is learning in the sense that allowing the communities to respond to the learning by first acknowledging that, yes, it's good to be quantitative, but it's also good to be qualitative. And therefore, we have these case stories coming in as part of embedment of monitoring and evaluation, but also critical to it is coming up with a learning agenda, a very well built up learning agenda where we are questioning the assumptions. The assumptions being that for the particular program that I am currently working on is an advocacy program. And the idea behind it is that we want to reclaim sustainability, especially for export supply chains. But there are so many nuances to it, in the sense that if you want to reclaim sustainability, for instance, you will need workers, farmers, and miners, which is a supply chain the program is working in, to really speak out for themselves. So therefore, the introduction of self-governance comes in. So the assumption is that amplification of citizenry voice will lead to better positioning of these people, and therefore push policymakers and power holders to question the policies that are governing the supply chain. So what I've done is to come up with a couple of questions, not very many, but a couple of questions that are geared towards these assumptions we made. Are they actually real in terms of context? Are they still real in terms of what will work out either in favor or disfavor of the farmer, miners, and workers? And then on the whole scale of learning, is also questioning the program itself. I know it's a dangerous path to take. It's had its own challenge, because as donors, they are very appreciative of collaborative synergy, leveraging on each other. So in the program, you find that most of these development programs is consortia based. So trying to question the power hierarchies within the program has kind of set me off balance, but I still want to question how the program structure has been upholding the entire delivery of the program to the donor, to our clients, but also to us. What does this mean? It means that I will not be able to do it myself. So therefore, I tactfully how I've done it is because we want to institute midterm reviews or quarterly reviews where you have someone outside looking in. You embed this in the review processes. So therefore, they are able to draw out from the voices that would not have spoken anyway in the program, to say that the power hierarchies and the way the program is structured is a little bit ineffective, and it's actually reproducing inequalities. The other thing that for me practically I've done in the sense of trying to broaden this, because intersectionality allows us to really stretch. So another thing I've also tried to do is re-question whose knowledge is being produced. Because then if my knowledge production has this whiteness of it, where now it's just empirical evidence, so therefore the old indigenous knowledge fades away, then I'm not really embracing that aspect of people coming in from where they are situated and sharing and advising the program. That is just to kind of give a little bit of how I've approached it. And with this basis of information of designing the learning agenda, it allows me to have a basis for discussion. Because even if I was a donor myself, I would not want to go with heartfelt, emotional, oh, people are, no, it is money being put on the table, $1, €1. So I would want to be convinced by either information or evidence coming out of the program, internally and also externally. I think the other thing before I make my departure point is also redefining how we start. So therefore, for a very long time, in my case, analyses are always after funding, which is a situation we all find ourselves into. There's nobody who can blame to that. So I think what I would say I have managed to do is to set out another trajectory of trying to understand how do we redesign it. My first step was recognizing the scope of the program. So therefore, I'm very much aware what is my boundary? So is it my program at micro level? Is it at meso level? Is it at macro level? So when I'm aware of this, I'm able then to kind of have donor relations discussions that these are the targets, this is what we need to do, but then we are going to confine ourselves to the micro level, and therefore leaving some key elements that could have also been integrated at meso level. And therefore we need to move beyond the individualistic approach of micro household level to understand this, whatever we are doing has a ripple effect at community level. And therefore trying to renegotiate, rediscuss, see whether there's any money that can be added to the resource envelope. Of course, it's a journey. It's not to say that I'm in the Grammys, but it's a journey in itself, and we are learning and learning, but also trying to formulate ways that can be practical, be felt, but also very inclusive, because you also want a space or a scenario where it's not only being steered at the front, but also being steered at the middle and also at the back.
Thank you so much, Njeri. That's actually, again, lots of things in there to unpack. You know, this isn't about an individual, it's about the collective, it's multi-level. And I think all of that's really helpful for all of us in the space today. Dusa, I'd really like to be able, I'd like you to sort of come back on that, any comments you have to sort of wrap up this section. But if I could bleed that a little bit into the Q&A, because in the comments, quite a few people have raised, and I think quite rightly, that a big challenge that, you've talked specifically about your experience of working with LGBTQIA communities. And there are lots of contexts where this is potentially a challenge. These are people that actually, if they self-identify, there may be real risks to them. And so then finding, let alone building collective voice, is creating all sorts of other barriers. So please do come back and sort of add anything that you feel that you wanted to say in this section, but also if you're able to address this comment in the chat, because quite a few people have sort of said, look, the risk of working with marginalized communities where, even coming out in whatever way is actually just maybe the biggest barrier to anything that might then, amplify their voice, lead to more intersectional inequality. So if you're able to speak to your experience in whatever way that is safe, please do so. I think that's something that's coming out in the chat that I think people would appreciate hearing about, this question of how do we manage risk as we work in this space, because not all participants will be able to participate in ways that will allow them to feel safe. So please do say, over to you.
Okay, thank you, Lata. So I would first of all start with saying that in Nigeria, where I live, the LGBTIQ plus community have been able to design capacity building trainings for people within the community. Now, when we get to the grassroots level, and I'm talking about the very remote areas in Nigeria, where you are intended to implement programs that are specific to the LGBTIQ community, an approach that usually works is coming from the health angle. Now, if we're talking about health issues for LGBTIQ plus community, when I am not saying, or we are not saying that, when you go into these communities without recognizing what the risks are there for you as a queer person, you highlight your sexuality first or your sexual orientation. No. There are approaches, the human rights approaches, the health approaches that we use when we're implementing in these very remote areas. Now, like I mentioned, capacity building. Our capacity is being built and oftentimes strengthened to be able to advocate for ourselves as sexual minorities in Nigeria. So what I mean when you're using an intersectional approach, I mean that if you're doing a program or you're designing a project that is speaking to the sexual reproductive health and rights of LGBTIQ plus people, now and then recognizing that within the LGBTIQ plus community, there are sex workers, there are people who use drugs, then these people who are part of these marginalized groups should make up the programming team is what I'm talking about. Now, there you would have people who have had their capacity strengthened over time. And I mean, we have people in Nigeria, in West Africa, who are very out and spoken. Now, nobody is being pinpointed or specifically picked out of their will to come and be part of the program. Before you're part of the program, all of these are being considered. Are you safe? Are you comfortable? Are you able to do this? Are you able not to do this? These are all of the things that we put into consideration. And that is also because we do not want to leave anybody behind. It is not okay to have a program that speaks to the needs of LGBTIQ plus people and heterosexuals are dominated in the space. No, that is what I meant when I talked about making the project inclusive of these people who belong to these marginalized groups. By that, they are able to even talk about their own experiences, their own lived experiences, better than another person who is an expert on the issue would. Thank you, Lata.
Thank you so much, Duce. So before we go ahead, we're a little bit behind time, but I'm hoping that at least for those of you who've been active in the chat, some of your sort of comments have been responded to, questions have been answered. We have a Q&A sort of section now where if you'd like to ask a question, please raise your hand. If you're not comfortable or your bandwidth doesn't allow, then please feel free to put your question in the chat and I'm happy to read it out for our speakers to respond. But while people are sort of thinking about what they might want to ask, also please don't forget we are going to be having our breakout room, so there will be a chance to go into more depth. But I think one of the things, Duce, that you said is quite striking, and it echoes, and Jerry, what you said, was the fact that we need to be asking these questions early on in whatever cycle of activity that we're engaged in. That feels like a really important lesson, which is that if we want to amplify intersectional experience, we want to address the inequalities that might come out of those, there's no point in asking the question even in the middle or the end. We need to be thinking about questions of risk and harm, but also inclusion, about voice right from the beginning, and then they become a part of the planning and the strategy and the evaluation right throughout the process. That feels really, really important. And maybe in our breakout groups, we can collectively brainstorm about what that actually looks like, right? When we're actually planning, what sorts of strategies might we use? So I think that's been a really helpful thing. Obviously, the floor is open now. If any of you who are here are able and would like to, please raise your hand and then we can invite you to unmute. As I said, if you feel that you don't have the bandwidth to connect with audio and or video, please feel free to put your question in the chat and I'm happy to read that out to our fantastic panelists. And actually, in Jerry, unless your bandwidth's not allowing you, if you're able to put your video on, no problem if your bandwidth's not allowing, but oh, great. Okay, you're there. Wonderful. Okay. Yes. So I'm sorry, I've got an initial. So S. Ekasi, I'm sorry if I've mispronounced your name, but if you feel comfortable to unmute, please go ahead and ask your question.
Yeah, thank you very much, Latter. I hope that I've not unleashed your name likewise. And thank you to Jerry and Didi for the amazing and passionate presentation. My question goes to both of you. So as we talked initially about, intersectionality and how we navigate with inclusion, I've noticed from my experience in various organizations that it's pretty sometimes hard to make informed decisions when we do intersectional analysis, and we realize that, okay, inequities tend to overlap. And but we might confront ourselves with aspect linked to risks, exposure of the vulnerable groups, aspect linked might be to insufficient budget of funds, or might be aspects linked to the current dynamics at the level of the community in which we'd like to do the program. I would like to know in your experiences, what are the, if I can say, pathways that you use to take appropriate decisions to really ensure that, okay, you have at least a sort of balance integrating, all the different identities that could overlap from the intersectional analysis that you do, and that could equally be addressed with the available means. So that is my question for the two of you, and thank you already for your passion and the very interesting experience you shared. I do recognize a lot in that. I feel very, very grateful to not, be alone. Yeah. Thank you.
Fantastic. Yeah. So who would like to go first? Oh, and Jerry, please, you've unmuted.
Yes. So I'll just give a very practical example of how I take a stab at it. So for a very long time as a gender practitioner, as I had alluded to earlier, you assess gender relations. But with intersectionality, the tweak I've had to make is that I approach social relations assessment as a research. So I take a research angle. So by taking a research angle, what do I do? Or what does it mean? I start with the problem analysis as opposed to the groups who are affected by the problem. So once I'm very clear what's the problem, it's climate change mitigation and adaptation, where it's in a certain group. So if it's close to the lake or to the ocean, who is that adversely affected? And then that's when now I start sieving through who is in that group affected more. And then if in that group it is men, young boys, okay, so in which age category? So that allows me to not go so far wide, casting my net on the basis of also Ekasi has said, we are constricted by resources. And therefore I need to be very, very, very dissectful in terms of who am I going to target the program? So with me taking that research approach, because research, you have to have the problem first, then kind of work throughout, because then you know the sample you are working with. So that allows me then to say, okay, this is a sample that are going to be part of this project. And this sample comprises of poor women who between this age bracket have maybe Muslim or Christian. So it allows me to kind of sieve through and then therefore come up with a good sample. And what also I've noticed is that when I start with the problem, it kind of gives me a leeway to have a more in-person discussion with the correct people. Because if the person is not affected by the problem, but they are living in the same community, you find some people just want to be part of a project. but they are not really impacted adversely. But when we bring the problem on the table, it allows me to then know who is that really affected, and therefore what kind of solutions do they foresee on the basis of the fact they've lived in this problematic sort of atmosphere or circumstance. So it's more of we are meeting each other in the middle. So for me, I've literally approached intersectionality as a research mindset, as opposed to the way I used to do it as an assessment where you just do the domains and you are done.
Thank you, Njeri. Again, so much to reflect on. Duse, would you like to come in and maybe share your experience of this, please?
Yes, I mean, Njeri has said it all. Research is the first thing you need to do. So in my experience, there's a need to conduct a needs assessment. You conduct a needs assessment, and sometimes you have focus group discussions, with that particular topic, with the range of people that you're targeting with your programming, and also with your program team sometimes, to identify what are those issues that need to be addressed immediately. Because there are some of these issues that can be attended to subsequently, So, but when you're able to have conversations and do like a needs assessment, you're able to identify your priority area. and then be able to channel your resources to what is most needed at the time. So that's just very little I wanted to add.
Thank you both so much. I'm hoping we can pick up some of these discussions in the breakout rooms. I think in the chat, Micah, you've raised quite rightly, I think, the idea that we've got to think about intersectionality when there is, an intervention that's maybe targeting a group. And both of your responses, Dusan and Jerry, made me think that maybe the targeting is part of the problem. That if we have a sort of holistic problem identification as a way of thinking about, what's the problem we want to solve, then you work out who is affected by it. In a way, Micah, absolutely, you're absolutely right. And maybe the response to what you've said there is to turn it on its head. Yes, we want a solution for people who might have particular disabilities, but we don't target them. What we say is, what is the bigger picture problem we want to solve? And then work out differentially how people might be affected. I think that feels like a good starting point, and maybe a lens for us to then think about how intersectionality might help with a holistic problem solving approach. So that feels like a really good place to stop. I'd like to thank both our speakers, and Jerry and Duce. Honestly, you have really launched a fantastic basis for a breakout room discussion. And thank you so much for your honesty and your openness in sharing with everyone. Obviously, we'd like to hear from all of you. I'm going to turn over to Francesca, and we look forward to more engagement in the breakout room. So Francesca, over to you.
Great, thank you, Lata, and to the panelists and Jerry and Dose for leading us through this important discussion. I learned so much, and it just felt like that was a really rich discussion, and I think that we have lots to discuss in the breakout rooms. So thank you for sharing your experiences. So we will now transition to breakout rooms for small group discussions. And in these rooms, you'll have the opportunity to share your reactions about the event discussion thus far and share your personal experiences applying intersectional approaches in your work, including lessons learned and challenges. And you'll also have access to a Jamboard to share thoughts as well. So please be sure that you're also contributing to that Jamboard, which our team will be sharing links to in your breakout room. And if you're having trouble using the Jamboard, then please also let us know in the chat. So my colleague should now be assigning participants to breakout rooms. So you should be able to join your group in a few minutes, or a few moments. So give it just a moment for us to be sent to our rooms. I think that we're all back. So welcome back, everyone. We hope that you found the discussions in your breakout rooms to be insightful. I was hopping around to different groups and was hearing some really interesting conversations going on, and it seemed like everyone was having very fruitful discussions. So at this time, I'm going to ask, we have just a few more minutes in this event, and so do you want to ask a representative from each of the groups to share just a few takeaways from your discussion? And I think the facilitators should be sharing some of those key takeaways. So I'll just call on you. So Lata, do you want to go first?
Sure, thank you, Francesca. So we had a good discussion. Some people raised some points, but then sadly had to drop off, as is often the way. But nonetheless, I think the things that seemed to come through actually ended up being a lot about how funding is shaping the way we work. So I think that goes back to the point that Micah had made in the chat, and Fabio and Lungo and Ima all talking in different ways about how sort of money is allocated. It leaves us with an inability to be reactive as programs are being delivered. What if we find out something in the middle, something gets revealed and then we have no resources to respond? I think it reflects really well the discussion before we went into the breakout rooms that Duce and Jerry sort of talking about integrating that more holistic perspective and integrating that into the problem identification approach. In other words, we just work out what problem we want to solve, and then we work out how we. But I do think the reality of that in donor funding is actually quite hard. We tend to be quite siloed. And Fabio, you talked, you sort of shared quite openly, which I really appreciated, about the challenge of doing that, the way resources are allocated. So I do think there's probably scope for us to think about how we collectively support within our workspaces to sort of go, do we want resources allocated differently to help us do this, and to make that argument in a way that says, actually, if you allocate differently, we will be more effective, right? If we're genuinely like not wanting to leave someone behind or wanting to be intersectional, we have to think about our resource allocation differently. That felt like it was coming through very strongly. If anybody in my group, apologies if I've misrepresented, if I've got anything wrong, please pop it in the chat so we can add it to the discussion. But thank you all for your contributions. I really appreciated them.
Great, thanks, Lata. Sounds like your group had a lot of important points to make. So we'll go with the next group, and Jerry, I see your camera's on, so I'm going to go to you next. If you or another representative of your group can share some takeaways.
Yes, I had a very interesting group full of authors and not much of speakers. So we covered some few points in the jam boards. And one of the things that came back is that no one size fits all, but our target should be at ensuring equitable benefits, and intersectionality in its own ways helps us to get to that outcome. And also the second one is about understanding inequalities in a deeper perspective is needed. We didn't discuss much about this. And also the last but not least is striking the balance between the scope and the limited budget. So it goes back again to circling back what Lata was saying in regards to the resource envelope that meets us or is on our desk vis-a-vis what we need to address. If anyone in our group has something that I did not mention, please feel free to jump in.
I'm not seeing anybody jump in. So, and Jerry, thank you for sharing those takeaways. And I think, your points on finding a balance between, the funding and the scope is the challenge that many implementers face. So thank you for sharing that. We'll go with the next groups. Dose, I'm hoping you can, I know you're having some technical difficulties. Could you share some of the key takeaways from your group?
Okay, I couldn't stay throughout that conversation, but before I started having internet issues, I think Megan mentioned that the key takeaway was the fact that, and Jerry mentioned that you in employing intersectionality in your program, you should always start with the problem. And it was at that point that my internet kicked me out. So I think Megan or someone else from my room can say more.
I'm I'm happy to be nominated. I think so there were a few points that were raised, and I think so for me, one of the key takeaways was in Jerry's point about how to bring an intersectional lens into program design in particular, and avoid the sort of the checklist of identities and so on. But I think Eileen also made a really interesting point about thinking with an intersectional lens, not only in terms of outcomes, but also in the way we work, who is working, who is making decisions about how budgets are being allocated, and so on. And so often those two are followed separately. We think about who we serve and less about who is deciding on what the services, and so on. And I know Edith was just making a very important point when we came back to this group, so I'm not sure if there's time for Edith to make her intervention, but I would nominate her in turn.
Edith, we do have just a few seconds if you want to chime in to share additional thoughts.
Thanks so much, amazing ladies. I was giving an example of how intersectionality, we were talking about how we've been applying it in our given work. And I was giving an example of the projects that I've been supporting UNDP Iraq with a stabilization program. And I was giving an example of how when I started working on the program, they were focusing on the overall returnees from Iraq after the ISIS and reconstruction. And one of the biggest challenge to identify how intersectionality can impact the way we implement programs was I had to start working on asking the question of who, why, and when, who is benefiting in this program, why are they benefiting in this program, when are they benefiting in this program? And the question was, the question started bringing up other issues stating that although the program was purely designed to support the returnees of ISIS, we need to start looking at how do we actually start looking at the needs of the girls, the needs of the children, the needs of the women, the needs of the youth, the needs of the Muslims, and the needs of the non-Muslims. And that gave us a big overview of how we need to start looking at supporting different groups from a race perspective, class perspective, gender perspective, and social status perspective. So that's the interconnectivity of the nature of the work on intersectionality in programs that we work on. Thank you.
Great, thank you so much, Edith and Megan, for stepping in to share some of the insights from your group discussion. We'll go to the last group. Doris, you can share some takeaways.
Yes, we had a really rich discussion in our group, and Akasi volunteered to just share a few thoughts. Akasi, are you on?
Yeah, I'm on.
Thank you.
Thank you, Doris. So globally, I will try to highlight what were the main aspects that we discussed about intersectionality. So globally, in terms of challenges, we identify the aspect linked to operationalizing intersectionality, be it in programs or in research. And for sure, the aspect also linked to time planning, time effectiveness that was highlighted with the current pressure received generally from donors were equally highlighted as challenges to really give time to embed intersectionality. And we shared various experiences going from the ones linked to carrying on research on diverse groups, precisely on the managers and their commitment to gender equality and how their personal experiences could influence the workplace, the way their leadership style, and the way they implement programs or projects. We equally highlighted other challenges linked to program design, and the way we globally ensure that the programs are designed without our own unconscious biases. So based on that, we came out with two important aspects or factors why when using or why embedding intersectionality is, for example, to always to at least take a pause and check check on our own biases, how our own assumptions, do a self-reflection and really check our own assumptions and see what could confirm or infirm those assumptions, and do what it takes to anyway correct them in the case being. The second aspect is to really also on my behalf a quick observation on how committed or how our management is committed to certain questions linked to intersectionality. And we had a very varied experience that was shared by one of our participants on an analysis that she did on gender equality and leadership in organizations. So I'll probably might be give her the floor if she just wants to chip in more details, or Doris, if you like to back more details, or anyone for sure in our group, please do not hesitate to do so. Yeah.
I really liked what you said, Akasi. I think that summarizes it beautifully. I think, you know, we talked about the importance of acknowledging your own unconscious bias and pause and reflect both internally as a team, but also with your communities as you're programming. So thank you.
Great, thank you, Akasi and Doris, for sharing some of those takeaways. And it sounds like each of the breakout room discussions were just all really interesting and yielded some really important insights. I also saw a lot of inputs on the Jamboards, and those will remain open after this meeting. So please do continue to add to those as you continue to reflect on some of the discussion points that have emerged from today's event. I do have one final question for panelists, but before I turn it back over to them, we do have one request. My colleague Devin is sharing a link to a post-event evaluation survey in the chat. Please do complete this survey to share feedback on this event. We will be using this feedback to help shape future IDWG events and activities. So please do fill out that form. It's really helpful for us to hear your feedback on these sorts of events. I'll now ask panelists to spend just a few moments sharing a recommendation for a resource or a tool for practical application of intersectional approaches in programming. And we also welcome the audience to share your own recommendations as well in the Zoom chat. So Lata, I'll start with you. If you can just share a recommendation for a tool.
So I think I shared with you two things, but the one was that there are plenty of tools out there, and I believe I've shared something called a gender integration tool. But I think for me, what's more important in a way, and what seems to be coming out of the session, is that there's no single tool that's going to solve all the problems. That's right. It's the GIP toolkit. And this is coming out of a consortium research project. And I think it's a really thoughtful one. It sort of thinks about, you know, it's very contextual. It's encouraging us as, you know, programmers to think about the context and to sort of try to anticipate, you know, what it is that we might need. But I think for me, the overriding sense is that we must really, and Fabio made this point really well in our breakout, which is we really need to understand the context, and we need to sort of push back on a tendency to try to, you know, create a sort of program before we have fully understood that context. So I think for me, any of these tools just needs that sort of proviso. We must go in with a sense that actually it's only going to help us part of the way. We have to actually do the work. We have to partner with people who have the knowledge in that community or whatever, local movements, local organizations, and that then these tools are supports. They're not the thing that drives any intervention. But I'll hand over to other speakers, and thanks again for a really thoughtful session.
Thanks, Lata. Lots of important points there. And Jerry, would you go next, and then Dose?
Yes, thank you so much. This is something that we never usually like sort of latch onto, but gender training, intersectional gender-based analysis, capacity enhancement program are actually tools in themselves, because they allow you to be speaking from a point of information, from a point of this is what you could accomplish. So in themselves, they are advocacy tools, both at internal institution level, where we need to change the construction of how systems are organized when it comes to development programming and also humanitarian aid. So that is one tool, advocacy tool, that I would recommend. And with that, I would like to invite any of you wishing to join. I usually train on the same about intersectional gender-based analysis. And what I usually delve into, because we have had so much work going into the micro level, I usually do the meso and the macro, which is we have scanty of approaches or practical ways to go about it. So I kindly invite you to join my training, which is going to be in September. More to that, on the basis that I've grappled with this intersectionality, and especially allowing myself to try and fail. So a year ago, I came up with, I would say, a basket of a tool in terms of a reporting template. And this is where I build the linking and learning aspect with M&E and the work that is done in the field, trying to bring along my other colleagues, because they are just technical guys, people who've done sciences, people who've done agricultural science, soil, all that, trying to bring them along through a reporting template where it's easy and light, and also trying to recalibrate where are we in terms of gender transformative programming, where we embed intersectionality, not only at the start point, but throughout the program, allowing ourselves to be very cognizant that we have to say that we can't handle all the world problems, but we can handle those that are within our scope of influence. And therefore, that has lessened the guilt burden in me that my program or the program I'm supporting is not wide enough spread. And it also gives me the opportunity to collaborate with others and also to build a movement, because right now movements are the in thing, and I want to be part of the movement of change. So that's also a tool. And lastly, because of the locus point of power in intersectionality, there's one tool that I've used, which is the Power Cube. The Power Cube has been tested. It's a nice tool that helps you to oscillate both in terms of micro, meso, and macro level, but also in different spaces, closed spaces, open spaces, invisible powers, with gatekeepers. It allows you to interrogate or investigate where power lies and how those powers affect different categories of and groups of people on the basis of their human interaction with different systems of power. So I will stop there and hand over the mic. Thank you.
Thanks, Njeri. Dose, I don't know if you're still there. No, she was having some connectivity issues. I'm not seeing her in the meeting, so I think she might have unfortunately dropped off.
Oh no, sorry, she is. She's back now.
Yep.
At least I can see her. Right at the bottom of my screen. But whether she's actually connected or if that's just.
I see her too. Dose, can you hear us and unmute and share the recommendation? Not, oh, I see confirmation. If you're speaking, we still can't hear you. Oh, I see. She'll share some resources in the chat. Thank you. All right. I know that we're at time, so we'll just quickly share some wrap-up remarks. Thank you all for sharing these resources and for all your contributions to today's discussion and for sharing your personal reflections. I do want to note that the key takeaways and recommendations emerging from today's event will be shared with IGWG members afterwards. And again, before you log off, if you can please fill out that post-event evaluation survey document that should be linked in the chat. I do also want to extend a huge thank you to our moderator, Dr. Lata Narayan-Swamy, and to our panelists, Jerry and Dose, for their immense contributions to this important discussion. I'd also like to thank our colleagues at USAID for all your support in the conceptualization and planning of this event. And thank you to the IGW team for all your support in helping to carry out this event. So special thanks to Doris Bartel, Jade Lang, Devin Degnan, Grady Parmu, and Catherine Streifel for your contributions. And lastly, thank you to all the IGWG members for your attendance, support, and active participation in today's event. So with that, I will say goodbye, and please enjoy the rest of your day or evening. And again, please don't forget to fill out that evaluation survey. Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you.
Thank you, everyone, for a good job.
Thanks, everyone.